Hi, this is Jonathan Fan, licensed acupuncturist. Today, I want to share with you a very important message. Unfortunately, my teacher, Mr. Gu Chengde, got COVID-19 and was hospitalized at the end of February. However, he discovered a very important secret that allowed him to recover his lung function and bring his blood oxygen to normal with the stimulation of breathing and meridians points when his blood oxygen level was less than 90%. Mr. Gu and I want to share such important news, and hopefully more COVID-19 patients can recover smoothly as he did. Let's take a look at Mr. Gu's personal explanation.
Hello， 大家好，我姓顾，叫顾承德，出生呢1946年10月31号。这一次呢，我是被传染到了新冠病毒。在2月28号那天，我感觉到突然浑身无力，站不起，也坐下也难过，胸口闷，觉得人无力。结果没办法，打了911，送进了医院。到了医院，当然第一天很忙，是检查等等，就是人很多，大家都躺在急救室里，大概待了1天吧，有了一个临时房间。到了第3天，才有正式的病房，我就住进了病房。住进病房的时候，那心安了，就开始关心自己的身体了。这个时候，每天医院都会来好几次测量你的血氧来检查，结果就发现了一个问题，我这个氧气呢是开的数字是6，我的血氧呢一直是89、88、90，超不过90。我就问医生，我怎么会这样呢？医生说你一直这样，你进来的时候救护车就帮你开到了6。那我知道了。那一个问题就来了，为什么会产生开到6，它仍然上不去呢？我就想到了，这肺是不是给新冠病毒这个毒把肺的神经给伤害了？我想到这里，我就用手去摸这个中国传统的肺经的中府云门，摸上去没什么大反应。那我就想到神经的反射作用都不强烈，那就是个大问题，一定要解决的。当时我有了这个想法以后，我就用手不断的去挖抠，然后用手指，代表就是中国传统的中医的针灸刺激，我就反复敲敲再敲2遍，不停的敲，敲了以后再用这个不断的震动，累了休息一下。第2次我重复又做了1次，这个时候我用手摸的时候，明显痛感很强烈，那就是说它有苏醒了。既然它能苏醒，那肺的功能是呼吸功能，那就得用呼吸去配合。传统的东方呼吸是2种，一种是深一吸一呼深的，一种是浅的2吸一呼。在这2种我试了，用一吸一呼，它进去以后，肺里面可能有很多垃圾，它直接把它推出来，那就产生一种什么咳嗽。结果呢，只能用吸吸呼。那么在病房里我不可能做，我就这样躺着，敲的过程中来做。就在这个做了以后，1个小时以后，护士又来检查，突然发现我的血氧从90不到跳到92，大家都觉得很奇怪，我也挺高兴的。结果就坚持做了，就产生了一个效果。很快我的血氧提高，他把它放到3也能达到90，就是说医院认为我很多解决了一个肺就是神经不兴奋的问题，解决了。
Mr. Gu is 74 years old now. During the first 3 days at the hospital, he was on oxygen 24 hours a day, but his blood oxygen level was still less than 90%. We know the normal oxygen level is between 95 to 100. With the breathing impaired and the oxygen level so low, the body will accumulate toxins. After a long period of hypoxia, the brain will not function normally and the person will feel muscle weak and fatigued. The longer the body stays with low oxygen levels, the more damaged the body will become. This is an obvious result. At that time, Mr. Gu could only using his knowledge to find ways to help himself. Fortunately, Mr. Gu was proficient in traditional and classical Chinese medicine and Taoist health practice, so there are many secret methods. Mr. Gu used his own experience to verify the usefulness of the methods he learned in the past, and they really worked. He survived and overcome the illness. After the 10 days in the hospital, he was discharged with the home oxygen concentrators. Next, Mr. Gu will demonstrate what he did to continue repair his lung function after returning home.
好，现在我让大家看一下啊，这个是2，你看到了没有？我是带到2，因为我现在不需要很大。这样以后就像医院一样，带着氧气做吸血腹，再敲。这个呢，就是说，先把它放上去以后，你看着啊，先89啊，现在89以后，我开始做。现在93了啊，94了，看见吗？它慢慢就自然，你不敲，它也能达到95了。这就是这个吸血腹的好处。
You may have questions. In the video, Mr. Gu was using oxygen. Therefore, his blood oxygen will rise up. How do we know if that blood oxygen rise is related to the breathing methods he is using? In fact, Mr. Gu had been using oxygen since he got on the ambulance. The instrument was turned on to 6, which means he's inhaled 6 liters of oxygen per minute. But his blood oxygen did not exceed 90 in the first 3 days. This is because the nerves leading to the lungs are invaded by the virus. The alveoli cannot exchange oxygens normally, and the lung function had been impaired. Now, the lung, after his continuously breathing exercises and tapping on the points that are beneficial to the lungs has become much better. So the blood oxygen indicators went up. You may be wondering, do patients with COVID-19 have to rely on using oxygen in their lives for a long time after return home? Mr. Gu's personal experience tells us no. He can using breathing exercises to gradually improve and restore lung function.
好，现在我就再讲一个问题啊，平时基本上不用呼吸器，只要在自己发现它的数值，现在你看这个数值啊，96、94，如果它下去了，就做呼吸法。对，它会下去，它维持不久，因为终究是立不住。比如说现在到了92，我就要做呼吸法了，比如一边敲，一边吸腹。这样，它就是没有呼吸机，它也能达到95，这就是通过自然的95、96。但是呢，这就是你平时在没有呼吸机的情况下，你也能做得到，这就是达到正常人的正常标准。但是因为终究年纪不轻了，所以它维持不久，就是说你要反复做。所以我把我的经验，这新冠病毒经验，而且把新冠病毒最可怕的就肺的神经没有反应，最后用就呼吸机了。如果有反应，他就不需要用呼吸机，那每个人都能把这条命留下来。所以呢，我的2个学生 Jennifer 跟 Cam 他们会仔细的讲解，因为我的英文不好，他们会讲解。Cam 有可能也能变成西班牙文打在下面，就是让大家充分的理解，因为一个真正患过的人，他经历过肺神经的，就是功能的不正常，经历过，所以他有切身的体会。如果能把肺神经激活，我相信很多人都能够活在这个世界上，不会走。所以今天呢，我就把这个3段啊 让大家看一下，了解一下。至于其他，让我的学生来说。好了，祝大家身体好，祝每一个患有新冠病毒的人都能像我一样走向康复，走向正常的生活。OK， 谢谢大家。
After Mr. Gu went home, he still needed to using an oxygen concentrators at first, but by practicing the breathing method with the oxygen supply, the lungs can recover faster. However, when walking and exercising, he still feel a little bit breathless due to lack of oxygen. Mr. Gu told me that he is getting older and hopes that other important points not mentioned in the films will be added by his students. I have had the honor to learn Chinese medicines and the Taoist health exercise from Mr. Gu for so many years, and I have a deep understanding of the importance of breathing. With nearly 20 years of clinical practice in acupuncture and massage, I know and see how acupuncture can improve the body's nerves conduction and organ function by stimulating acupoints. In traditional Chinese medicines, there are many of these points on our back, which also help the lungs. When Mr. Gu was in hospital, he couldn't stimulate the acupuncture points on the back himself, so he could only tap on the chest. After he came home from the hospital, he asked his wife to help him massage the points on the back, combined with the breathing methods introduced earlier, so that he would recover faster. I will demonstrate it now. So for this exercise, we want to do is continue practice 2 breaths in, 1 breath out. At the same time, you want to massage the back point, as that's showing here. So you want to massage, at the same time you practice breathing. Later, I verified that his method is really effective. I have a 92-year-old patient. When she came to the clinic one day, her blood oxygen level was only about 84%. I told her to practice breathings for about 2 minutes, and the blood oxygen level rose to 94%. I helped massage the acupuncture point on her back and continued ask her to practice breathing. Then her blood oxygen rose to 99% all at once. This tells me that stimulating this acupuncture point and combining with breathing methods may quickly improve the condition of low blood oxygen. In addition, another important movement I want to introduce here is the lung deep cleansing method, which push the diaphragm up, massage the lower part of the lungs through the movement of the diaphragm and push out the turbid airs in the deeper layers of the lungs. By doing these movements, the lungs will live a better chance to restore totally. So this exercise, you want to put your hand just right below the diaphragm. What you want to do is 2 breathe in, 1 breathe out. At the same time, push your diaphragm upward when you breathe out. It looks like this. Breathe in. For this exercise, you want to find a sensitive spot on your sternum. So you press in the front of your chest to find a sensitive spot. Put both your hand there, and you want to do same thing. 2 breathe in, 1 breath out. Now, summarize. If you start to have difficulty breathing and a blood oxygen level drop due to the new coronavirus, Don't panic. In addition to following the doctor's advice, you can also use this method to help yourself. First, press the lung reaction points from chest and back. Second, 2 breathing in and 1 breath out. Third, lung deep cleansing exercise. Fourth, lung function strengthening exercise. Please note that these movements are not enough to be done once. They should be practiced repeatedly. Do them when you have strength, rest when you are tired, and continue doing them when your physical strength is restored. Mr. Gu is about to be 75 years old. If he can recover through these methods and his own effort, so can you. After lung function has recovered, and the next step is to improve immunity and eliminate the virus completely. Thanks to Mr. Gu for developing a set of T-cell exercises for more than 10 years, which can stimulate the active of thymus, help our immune cells and T-cells become more powerful to deal with invading bacteria and viruses. Please refer to the video I showed before. The pandemic continues to be serious, with too many people around the world still suffering. Mr. Gu and I hope that through this video, the unfortunately infected patient will recover sooner. For those in areas that still have a severe pandemic around the world, you can contact me if you need to. I'm happy to teach exercise in the group online. You can contact me through Facebook or email. My contact information can be seen in the description. If you think this may be helpful, release forward to people you care about. If you would like to learn more health improvement methods, please remember to subscribe to my channel. I wish you all the best health. Thank you for watching.